In this study, we did a retrospective analysis looking at outcomes of transplant recipients who developed COVID-19. We had one of the largest databases of these patients, transplant recipients with COVID-19, through the CIBMTR. And we showed that patients who have received a transplantation and developed COVID-19 at a high mortality risk, with an estimated survival of 67 to 68% at 30 days after developing COVID-19. We further looked at various risk factors which were associated with worse survival. And we found that in allogeneic transplant recipients, age greater than 50 years, male gender, and having received their transplantation within the last 12 months were all associated with worse survival. While in case of autologous transplant recipients, a diagnosis of lymphoma in comparison to plasma cell disorders was also associated with a higher risk of mortality. Many of these factors that I just stated for allogeneic transplant recipients were also associated with worse survival in autologous transplant recipients, but were not statistically significant in our database, perhaps because of the smaller number of autologous transplant recipients.